ready for one, I think another meeting. Because we're waiting on the office. I want them to be able to take me so that they can hear me. The Public Safety Standing Committee for October the 2nd, 2023. It is now 4:02 PM. We're about to begin, and I call this meeting to order. Roll call. Alderwoman O'Neill.
Present.
Alderman Gay. Moving on to approval of the agenda. Can I get a motion to approve the agenda?
Motion to approve the agenda as written.
Second? All in favor?
Aye.
I don't hear any opposition, so we will move on. The agenda has been approved. Moving on to business and miscellaneous, approval of the minutes, PSC 7.19-23, special meeting minutes. Can I get a motion to approve the minutes?
Motion to approve minutes from
Second.
7/19/23.
Second, all in favor?
Aye.
Aye. All opposed? I hear none. The minutes have been approved from July. Next we have on the agenda is our legislation, O-28-23, which is city noise prohibitions and enforcement for the purpose of updating the Annapolis City Code noise prohibition section by adding a ban on certain noise in residential areas, expanding enforcement, and generally related to noise prohibitions. And I think we have an amendment by you, Alderwoman O'Neill.
I'll talk about it. So I know that the city noise prohibitions came about for lots of different things, but it just needs to be updated. And incorporating into this, there's also a ban on gas-powered leaf blowers, which I'm in favor of, but my amendment asks for a delay in the enforcement of gas-powered leaf blowers until December of 2024 in order to give adequate time for people such as landscapers to not only replace their current gas-powered blowers, but to figure out their systems. As much as the environmentalist in me agrees with getting rid of the gas-powered leaf blowers, they do cut down significantly on the time it takes for somebody to clear leaves off of a significant area. And I've talked with 4 different landscape companies, both minority-owned and bigger companies, and they tell me that 2 things are going to have to happen. One, replacing their equipment with a battery-powered leaf blower. It's similar in cost, so that's not really the issue, but because it's now going to take them longer, then they're going to be charging their clients more because it's more time spent, more hours, manpower hours. So I'm just asking that we give them adequate time to go through a season where they're starting to transition. I would also like to see if we could do something that helps give some incentives. And I'm working with a couple of the local, trying to work with a couple of local suppliers to see if there's some kind of incentive that we can work out for landscapers to make the move.
Okay, thank you very much. We have been joined by our Ward 1 Alderwoman, Ms. Eleanor Tierney, and I don't know if you wanted to weigh in on legislation O-28-23.
I do, thank you. I'm sorry, I didn't know you were going to review legislation first. So as my colleague said, the noise ordinance is governed by state code. And they did designate with enabling legislation for us to adapt our own, but still using their standards as far as decibel level, et cetera, et cetera. where this legislation is still needs work, and I'm glad we're in committee, is the enforcement of the noise ordinance. There is language in the bill right now, and I call attention to Title 11. A violation of any provision of this chapter is declared a municipal infraction, and for each violation, the violator shall be subject to a fine as established by resolution of the City Council. Noise. Violations of the city's noise ordinance, Title 11 and 12, because of those titles, shall be subject to enforcement by the Director of Planning and Zoning, the police chief, or their designees. That language kind of troubles me because the Director of Planning and Zoning is not going to enforce a noise ordinance. But I think because of the title reference, that's why he or she is listed. Any of our bills, it always comes down to enforcement. And I think it's really important that we discuss today whether the police department can enforce this noise ordinance. There's been, for the last several years, this whole thing about who has the decibel meter and all that stuff. Well, it's kind of silly because decibel levels can be read on a cell phone. I mean, you don't need this strategically, coordinated thing to measure decibel level. The way it works really is, or at least what I tell my residents, is if there is a noise that's substantial and they know that it's higher than decibel reading or amplified music, they do call non-emergency police. And the non-emergency police do come and they very politely tell them a first time, look, you're over. And then if it continues, they come back and there would be this infraction. I don't see Cynthia, our legislative aide, here to understand why this Director of Planning and Zoning is listed in here, because that troubles me. But we have.
Yeah, I can speak to that. Usually because it's a municipal infraction violation, it's going to be the responsibility of planning and zoning largely to be the ones that actually enforce it. So it's more of an emphasis on the designee part, like your inspectors that are going out. There's no expectation that the planning and zoning director himself is going to go out and actually issue these municipal infraction citations. But that's just standardized language that's in code.
So I should read this, though, so that the police still have that enforcement power?
They do, but keep in mind, this is a municipal infraction, so it's a civil citation. It's not a misdemeanor, it's not a crime.
Meaning what for the public when you say civil?
Meaning it's not a crime. So it's a question of whether or not you want the police department to change or reallocate some of their resources to go towards the civil citation process versus having their resources directed towards crime enforcement.
The reality is, though, that we don't have enforcement agents from planning and zoning on the street to issue citations. There was discussion in the budget about having someone part-time, et cetera. But that person doesn't exist right now. Am I correct in your understanding as well? I mean, remember there was, I think, Mr. Malinoff, there's no representative from the city manager's office, right? Actually, is Mike Malinoff here?
He's in a conference. He and Vicky are both in a conference.
Oh, okay. Because the only reason I say that is that he had, I think it was almost two years ago now, that we were going to hire this enforcement person that would be under planning and zoning. So I don't know if I can change that language. I just want clarification that, like I said, the reality is, who do they call? The resident or the complaint or the business, as I just had this past, Sunday night. There's a gentleman that plays amplified music down at City Dock, and then he knew the boat show was coming, so he moved to be in front of a store, and the store called me and said, what is this guy? So, the police did come, and they just told him to, go away. But that's the reality. There's nobody in planning and zoning after hours right now for the resident to call. And I just want to make sure that the legislation is in line with that, or does it give us that liberty? I know the police have a lot of other things to do.
As it's written right now, it does, because it has that discretionary authority between planning and zoning. And so should they get an inspector that is going to be, or an inspector that's going to do weekends and nights, they could be the one that goes out and issues the citation, or it could be the police department as well. That the way it's written now has that discretion amongst both departments. Mm-hmm.
Okay, all right. Okay. And so as my colleagues said, we introduced the ban, lack of a better word, on the leaf blowers. I didn't have the opportunity to talk to landscapers. I did talk to an owner of a hardware store that we all know. And this is sort of the wave of the future, that we will be going electrical. It does not prohibit any business in the city to sell them. This just restricts the use of them. And I do understand the compromise that my colleague's amendment is offering. Is that on the floor, your amendment?
We would just be giving it a favorable recommendation.
Oh, okay. All right.
But I wanted you to make sure you had your say regarding the legislation.
Yeah, I just wanted to walk through the reality of how it works right now. And I applaud the law office for cleaning up the code. Because it wasn't updated since 2018. So thank you. Thank you for my time.
Thank you. Anything else, Alderwoman O'Neill?
No, thank you.
Can I get a motion to approve this amendment as written to be favorably submitted to our colleagues?
I'll make that motion.
So moved. Second? I second that. All in favor?
Aye.
Aye. I hear no nays. With that, can we have a motion to favorably approve O 2823 as amended to move toward our full colleagues?
I move to give a favorable recommendation for O 2823 to the city council.
Second, all in favor?
Aye.
Aye, I hear none. It shall be moved. Well, we'll move on to general discussion. ID 15223, City of Annapolis, partnership with Anne Arundel County, Cure Violence Interruption Program, Gun Violence Intervention Team presentation. There will be a short presentation by our City of Annapolis at this time. And that will be followed by ID 15023, Anne Arundel County, Dr. Tony Gedden, Cure Violence Interruption Program presentation. Good afternoon.
Good afternoon, Alderman Pendell-Charles and members of the committee. Thanks for having us here today. And I'd like to start this by affirming how much we appreciate the County Health Department's investment and partnership in our city in order to achieve our shared goal of reducing violence, and in particular gun violence.
Ms. Pettit, could you introduce yourself as well as your team?
I apologise, yes,
That's
thank
all
you.
right.
Been a while, I've forgotten the protocol. Kate Pettit, Chief of Staff to Mayor Buckley, and with me I have members of the No Harm Violence Prevention Team that operates out of the Mayor's office.
My name is Corinne Mako. I'm the current Neighborhood Engagement Specialist for No Harm VIP.
Hello, Adetola Ajayi, African American Community Service Specialist in the Mayor's Office, and I supervise No Harm VIP.
So I'm very happy to pass off to Dr. Gedden, who will talk us through where we're up to, but just a little bit of context, I guess, that we'd love to be able to offer to this is we've been working with the County Health Department for over 18 months now to develop a plan for bringing violence intervention to Annapolis and the investment of the Health Department to Annapolis. And we greatly appreciate the fact that they've chosen Annapolis for that phase of investment. The Mayor has a very strong commitment to developing a more equitable, connected and united community. And while previous mayors have engaged liaison staff to engage our diverse communities, under Mayor Buckley, that investment has moved out from sort of a more, I guess, ceremonial or liaison focus into building out relationships and programs that meet the specific needs of our underserved, underrepresented communities. For example, with our Hispanic liaison team has developed language appropriate services, including a text messaging service to reach members of our Hispanic community. And similarly, our African American community engagement team, led by Adetola, has worked to deliver programs that meet the needs of those communities, such as the Substance Abuse Prevention Program, NAM, that he also leads. And that program is really based on a model of local engagement and trusted messengers. It's people who are from the community, who have relationships with the community and build the trust in order to deliver very targeted and very personalised, sometimes, services to meet the needs of those residents. During the COVID emergency, an increase in violence and violent crime led Adetola to develop a violence prevention program called No Harm. Our need to continue and fund this work was what led to active engagement with the County Health Department last year. And they really pushed us to take a health perspective to that issue. And that then led to Tola identifying and reaching out to Cure Violence Global. They are a national and international leader in a violence prevention and violence disruption program. That means active intervention in local cycles of violence to prevent violent outcomes and limit the spread of violence. So it's like a disease prevention model. Last year, the county funded an assessment here in the city, and we jointly ran that assessment together out of the Pip Moyer Rec Centre. Cure Violence Global Consultants came to Annapolis. I know a number of the council participated in that assessment. And watched some of that unfold. And during the assessment, the Cure Violence team travelled around the Annapolis neighbourhoods to identify some of the communities that would benefit most from this kind of intervention, and also met and worked with the many community organisations and non-profits to assess who might be in a position to do that work. So we've continued to work with the county since the assessment last year, and we're very pleased to be partnering and engaged in the RFP process for the next phase of investment. And we also are continuing to invest in the No Harm program, which is based in Robinwood, and again uses that trusted messenger model. And Corinne Makel, who's with us here, is one of the lead people in that program, who is grown up in the community, is known to the community, and is working to deliver those services in the community. So we're continuing to invest in that model, and we are looking forward to giving the council an update on No Harm and where we're at with that and what we've achieved this year. But we are also very excited that the partnership with the county is continuing, and the joint investment that we're going to be making in Annapolis neighbourhoods and the way that that can bring multiple benefits to our community. So that's a bit of scene setting about how the relationship has developed and is going forward together. Thank you.
Thank you. Alderwoman O'Neill? No questions. All right. Well, thank you. And if you all could... Oh, I'm sorry.
No, I'm sorry.
Alderwoman Tierney, go right ahead.
What do you mean it's based in Robinwood? What exactly is that physical, and what is the, how many people are there, and hours, et cetera?
Yeah, so the No Harm team is a 3-person team with Tola leading the program, and Corinne is one half of the team. We have another community engagement staff member. Corinne works out of the Resource Centre in Robinwood, set times and hours during the week. She provides referrals to community residents. We've connected them to conflict resolution services and develop resolution workshops for them, deliver those in the community, financial literacy workshops, community listening sessions. So we also then refer individuals to services, employment services, other health services. So Corinne works during hours. She also works particularly with Annapolis High School through her relationships there to develop, relationships and support for younger residents. And our other no harm staff person, Lavelle Offer, works out of hours, and he tends to work with adults and trying to support them and provide those services to the older community at Robinwood. We wanted to invest locally in a community. I think it's fair to say that the work we did with the county last year and the thinking around that health model that they encourage us to consider pushed no harm to being a very focused program. And we wanted to look at work in the Robinwood community. We chose that community. Tola chose that community based on some of the statistics of gun violence last year. It was the highest incidence of shootings in Annapolis last year. And so we wanted to invest in that community. And we're going to be reporting back soon on what's been achieved, what the outcomes are, the evaluation for that investment this year, and what we see as the next phase.
The only reason I ask that is that there are two, for lack of a better word, resource locations, if you will, one at Harbor House and one at Robinwood, and I just want to make sure that they're utilized effectively.
Thank you.
So, yeah, Robinwood is where we're investing in no harm, and our partnership with the county has actually, the health department has taken that into account in how they've approached the RFP for a cure violence model in Annapolis. And so knowing we were invested there, they have considered other needs. So essentially what I mean by what I refer to as the partnership is, with that partnership with the county, we'll have investment in 2 communities of need going forward. So we're going to get real bang for our buck thanks to this partnership.
Thank you.
Thank you. Thank you, Alderwoman Tierney. All right. No questions. We'll move on to ID 15023, Anne Arundel County Cure Violence Interruption Program presentation by Anne Arundel County Health Officer, Dr. Tony Gedden. Good afternoon, Dr. Gedden. How are you this evening?
Good afternoon. Thank you for having me.
Good to see you, as always.
Yes, you too. I have copies of my presentation for you all if you'd like to follow along.
Certainly.
Bring those to you. Okay, thank you. Thank you, Director Simmons. Good. How are you? All right. So as my colleagues mentioned, this partnership
Is your mic on?
It is. I'm
Okay,
pretty soft-spoken.
thank
I'm
you.
bringing it a little closer. This partnership started actually over 18 months ago, working with Adatola to really look at the model for no harm, and then moving into Cure Violence Global, coming to do the assessment last August. And for those of you that participated, that was really to understand what the types of violence that are being experienced in Annapolis City are. When you're doing a violence interruption program, you want to make sure that the violence, and the gun violence specifically, that's taking place is something that this model can interfere with. So for instance, if most of the gun violence was because people were robbing other individuals, right, and you may have been shot in an attempted robbery, it's very different than interpersonal violence where you may know the individual, it's retaliation. And so coming into the neighborhoods to understand the types of violence being experienced, also whether or not as a county and city government and other officials, we had the capacity and the desire to do this. And so their assessment found that Annapolis was an appropriate place to bring the Cure Violence Global model. And so I'm gonna walk you through a couple of things. For the County Health Department, running the gun violence intervention team for the county includes members of the city, but also looking at our strategic plan. And for us, goal 5 has been to disrupt cycles of community gun violence through engagement with community members and partners. And so by engaging with the mayor's office and engaging with Cure Violence Global, and hopefully what will be a community-based organization to do this work, we really see it as fitting perfectly within our strategic plan goals. and we appreciate the ongoing partnership. When we look at gun homicides occurring in both the county and the city, we definitely seen an increase in Annapolis City between 2022 and 2023. Also looking at who are the victims of gun violence in Annapolis City, and I think Kate just touched on this, but about 65% of the gun homicide victims in the city are Black males. About 55% of those individuals since 2016 have been 25 years old or younger, and then you have about 19% under 18. So we're really looking at young Black men and children as your primary victims. And so that really led us down the path of what are the specific neighborhoods. So during the assessment visit last year, with a lot of help from Adatola to make sure that we were going to the right places, making the right connections with property managers to walk these neighborhoods and understand what residents thought and what their comments were, we were able to narrow it down to about 6 or 7 neighborhoods last year. This year, when we started to have community meetings to talk to residents about this program and saying there's the potential for us to be coming here. We wanted people's thoughts. We didn't want to come and say we're doing this, but we wanted to give the community an opportunity to give us their feedback, ask questions. Also, programs like this don't work if the community's not going to engage with the program. So understanding their thoughts and feelings, we narrowed it down to 4 neighborhoods. As Kate mentioned, because Robinwood was already engaged with the No Harm team. We looked at Eastport, Terrace, Harbor House, Newtown Drive, and Bay Ridge Gardens. So we hosted community listening sessions and meetings there to tell people what this looked like, what it could be, and then ultimately decided on Eastport as the community for this project. And so what does that mean moving forward? So looking at violence interruption programs, they really come with 3, and there's many different versions of this, but 3 main elements. So street outreach, which can include things like conflict mediation, resource navigation, youth mentorship, program and skill building, so offering things to the community to hopefully change norms around violence, and then coordination. So how do we come back to folks like you with reports on what's actually happening, whether or not we're seeing any impact from individuals setting goals for performance measures and impact reports. And so those are kind of the 3 elements that you'll see with this work. As Kate mentioned, we are in the RFP process now. It was released probably 3 weeks ago. I don't remember the exact date. Since then, we've hosted 2 pre-bidders conference for any interested organizations to come and learn more about the application process, what we're looking for, the project itself. There are a couple of things that you're really looking for in a CBO to do this work. You want folks to be credible and trusted within the community. You also want them to be able to recruit and hire individuals with potential criminal background, right? So those are some of the best individuals to do this work, to be a trusted voice, are people who have been in those situations themselves, and people from these neighborhoods. As Kate mentioned, Corinne makes an excellent individual to be doing the work that she's doing, and we're looking for more of those folks to be doing this. But you also need an organization that has the infrastructure and capacity to handle this. So it's a $450,000 grant. You're hiring a team of 6 to 7 individuals, so you need both the fiscal and HR capacity to do that. So those are some of the things that we've talked to organizations about in the pre-bidders conference. You also want someone who has experience managing grants, and as we mentioned, the public health approach to this means that you collect a good amount of data. So there's training, and I'll get to that in a minute on what that training looks like, but making sure that organizations both understand that and have the capacity to do that. So when we've had the conversations with neighborhoods and explaining how we've narrowed it down, we heard a number of different things. We heard programs come and go. We heard this is great, but what about other safety issues? For instance, do children have enough to do? Is there enough recreation in neighborhoods? We hear from folks when it's time to vote and we don't hear back. We heard, will the health department continue to engage in different ways? So we when we did these community listening sessions, we brought things like our Healthy Start program, our dental program, other health department services. It'd be great to see us at other times. And I agree. I concur with their thoughts on our continued engagement in the community. And then we heard a lot of just general concerns around violence and how normalized it is for people. And then we had a lot of questions about who qualifies to work in these programs. So when you say something to someone about people who have a criminal background and potential violent offenses, who will be hired, and how do you know that person is doing the right thing? Some of that comes from how long ago an individual may have been released from incarceration, but also whether or not the community says that this is the right person. So both the RFP and the hiring process are panels. It's not just the health department. So there's a member from the mayor's office, a member from the county executive's office, Melissa Maddox Evans, because we've chosen the Hacker property, is also participating in that, and a community member. Hopefully two, we're looking to recruit another, are participating in the panel and will be reviewing the RFPs. And it's a very similar process for the hiring. Also, Cure Violence Global really sits in to help us since they implement these internationally. They give great feedback on what we should be looking for. And so we want and welcome that feedback from the community. We welcome that input from you all. And there is, I don't know what page it is because we don't have these numbered, my apologies. But there's a slide entitled Staff Structure. And this really gets into what we're looking to create as far as the program infrastructure. So the county executive's office provided the money for this pilot this year to the health department, and then we will hopefully be pushing it out to a CBO, as I mentioned, with a project coordinator, a site program manager and supervisor, 2 to 3 violence interrupters, and 2 outreach workers is what the team will consist of. And again, you're really looking for folks from these neighborhoods who know people, who are trusted, and who understand the dynamics happening in the neighborhood. I'm not the person to do this work, right? I'm not from Eastport. I don't have those ties to the community. And I think it's important that we provide individuals with an opportunity to do that. One of the other things that is required is we've set a base salary for a livable wage for staff participating in this. We want this to be a full-time job. We're not asking individuals to volunteer. We want to make sure, and many people do make a career out of violence interruption and move up to do many other things. And so we'd like to see this as a stepping stone for employment for folks from these communities as well. On the next page, it really takes you through the timeline. And so we've done a lot of information sharing. We had information sessions for elected officials, other stakeholders, community members. We are now in the funding bid process. So we've held the pre-bidders conferences, and we've extended the date until October 13th that applications are due. And after that, we'll spend a few weeks as a panel reviewing the applications. There is a very specific scorecard that everyone will walk through. And that scorecard is included in the RFP, so folks know exactly what we're looking for. And then we will notify the organization that's selected and take it from there. After that, getting into hiring and then training and onboarding. And so another portion of the funding that was provided from the county executive's office is specific to the training that Cure Violence offers. Being from a neighborhood and familiar with folks is wonderful. It doesn't necessarily make you ready to go out and do conflict mediation without any sort of instruction or training. And so Cure Violence Global would be on site to do that training, to also train people in the database, and there are specific trainings based on the position you're hired into, and then some that are for the entire team. And they continue to provide technical assistance throughout the implementation process, check-ins, and regular team meetings to make sure things are going as they should be on the ground. And then the reporting. There are daily reports and logs required for these staff members. There are weekly performance measures, quarterly measures, and then these are things that we will need to bring back to the community, to elected officials, and to others, just to make sure folks know exactly how things are going and what we're doing. I'll stop now and see if you all have any particular questions for me.
Thank you so much, Dr. Again, I'm going to give Ms. Pettit an opportunity this time if she wanted to add anything based on what you, and she's nodding nay. Okay, thank you. Alderwoman O'Neill.
Thank you. I do have some questions. I appreciate that. So I just want to be clear. So the RFP that went out is to an organization, perhaps, that's working in one of the identified communities, that's currently working in one of the identified, or they're creating an organization to work in one of those communities?
So we would be looking for organizations that are already established. So as I mentioned, having infrastructure and experience is important. So I think that could be possible for a brand new organization, but more than likely would need to be established to be ready to hit the ground running with this. Ideally, they would be an organization that's already working in Annapolis and familiar with the community, but when talking to Cure Violence, because that's one of the things that the assessment showed in the report last year, is that we had a lot of small community-based organizations that were doing good work, but didn't necessarily have the infrastructure to support some of what we're looking to do. So whether the organization is specifically targeted to Annapolis or they hire individuals from Annapolis was the thing that they talked to us about being most important, and are willing to develop those relationships in the city and move forward. So ideally, yes, but I think we're open to other folks that might be doing this work in other places. They do have to hire individuals from the city. And again, we would have there are various folks represented on that review panel to make sure that they are known and familiar with the neighborhood. We don't want you coming in completely green with no understanding of the city or the dynamics.
And out of curiosity, have you had organizations already apply?
We have
that
not.
are-
No.
Okay. And is that why the deadline was extended?
No, actually, we've had a lot of people saying they wanted to share it with other people, and they've heard about it at different points in time. So we said, let's give it another week if that helps people have the opportunity to get it out. You heard about it this Monday, trying to get it to us on Friday might have been tough. So we had a couple of folks last week saying, I'd love to share this with X, Y, and Z. So trying to give that enough time for people to actually put the application together because it's relatively extensive.
Okay. I'm not trying to be negative on it, but it's very worrisome to me that it feels like our violence has increased exponentially. And if we have organizations that are working in there and they haven't been able to do anything thus far, how this would cause a change. So if that makes any sense, it worries me that the perception, whether it's reality or purely perception, is that violence is increasing, and we have citizens coming to us saying, what are you doing about this? What are you doing about this? And we're saying, we have this organization, we have this program that we're trying to get out. And how can we make it so that it is being helpful? And so it sounds like Cure Violence, being a more national organization, has some resources available that maybe we haven't known about before. Is that correct?
To my knowledge, I'm not sure that there's a program at this point with this many staff members and this particular very focused intervention. So I will say that Cure Violence Global is not going to stop all violence, right? It's not the end all be all. It is a piece of, I think, what is a much larger strategy. And I think anyone that's seen these programs implemented across the country would tell you the same thing. It's also neighborhood specific. So when I'm asked about, well, how has this worked in other larger cities that have implemented it, they still have a lot of violence. It's specific to a neighborhood. So if you're talking about Chicago or Boston, right? which neighborhood are you talking about? And so our data really looking at specifically what's happening in Eastport would be how we'd measure this. If violence is to uptick in another area of the city, I can't necessarily speak to that. And how do we say that this is working? I think that's coming back with the data, really looking at what they're doing, also talking to community members about what they're seeing and experiencing and whether or not they have a increased feeling of safety. Are we seeing gun homicides and gun injuries going down? Are we seeing a decrease in other types of violence in the community? I don't think this is the one thing that's going to answer all of the different issues that are, social determinants that lead to violence. We have to address all of those as a society, but I think this is one piece around violence interruption, and they have to partner with other organizations and other government entities. They don't provide, like if you're looking for employment opportunities, linking them to organizations that do that, but this is not their lane, right? So being clear on what this program is set out to do and what violence interruption is about and what it's not, I think is really crucial to not give people kind of a false sense of all of the things that it could do. So I hope that answers your question.
Sure. And I have one last question in regards to that. Basing this on, you have data from 2022 to 2023 and the differences in the the percentages. Will the data be, will we be looking at the data this time next year and comparing and contrasting and basing our future role in this particular program based on that data, or is a longer term period of, is it a year's worth? Is it 5 years worth? Where will we be looking for success or failure of the program?
Yeah, I think we'll be looking at it next year, and whether or not that's enough time to truly measure that, I think could be debatable depending on how fast the program gets up and running and how quickly they're able to integrate into the community. So I think some of those things will impact it, but also we've got a year's worth of funding. And so whether I like it or not, next year I'm back to either say I need more funding and this has been a success, or this is what we know or what we don't know and we need more time to see what else could come of this.
Okay, I appreciate that. Thank you so much. It appears that Ms. Pettit has a question.
Oh, Ms. Pettit, thank you.
Thanks, Madam Chair. I just wanted to let you know that in light of the increase in crime and shootings this year and homicides this year, we've been working, the Mayor and the Police Chief are working to pull together a briefing for the Council and for other critical stakeholders in the community, and we'll certainly be inviting Dr. Gedden and the Gun Violence Intervention Task Force to be there. I think an email might have gone out last week to start canvassing dates and times. And so part of the goal for that is to provide the context around trends, where the hotspots are in the community and so on, and help us all to try and understand what's happening now. Some of that information is already kind of being fed into the thinking that we're sort of taking forward, but I just wanted to alert you to those briefings are coming up this month, we hope, and that might help to provide some of that picture.
Thank you.
Rhonda.
Thank you so much.
Ron, I have 2 questions.
Yes, Alderwoman Tierney.
Thanks, I'm sorry. I have
That's all right.
I have just 2 questions. One of them is finance related, and if you just indulge me, I understand this is a grant coming from the county, but when I look at our budget for 2024 under county grants, maybe Kate, there's nothing there. So is this something that will be appropriated later, or how does, and thank you for indulging me on that question, but.
This is not a grant to the city. This is going to be funding to a community organisation who will be engaged to come in and do the work in the community, and they'll be asked to employ appropriate people to do the work based in Eastport.
So there's no money in the budget, in our budget for it?
No.
Okay. all right. And the second question I have is in the presentation, there was no mention of any sort of interface with our police department at all. And I was just curious, is that based on the decision that it is a disease model that you're using, and you know?
Yeah, absolutely. So one of the key, and I've had a conversation with Chief Jackson about this model and that we're moving in this direction, but one of the things that is key in implementing these models is that the individuals that are interrupting the violence in the community are not closely associated with the police, right? So that whatever they're talking to you about to try to interrupt violence or mediate a conflict, that it's not seen as going directly back to the police, because it's also very dangerous work for the individuals who engage in it if they are seen in that light. And so making sure that the police are really aware of what's happening, and that when it becomes a police matter, they step away. It's no longer for cure violence to be involved, and understanding what those two different lanes are. But that's one of the reasons that you don't see it specifically listed here, is because in order to do this sort of conflict mediation and mentorship, individuals need to feel that they can talk to these people, and also that they are, just not another extension. That's one of the reasons that Cure Violence Global recommends that it be a community-based organization and not a government entity like the health department or others. I can't tell you that I don't work with the police. Of course I do. It's a part of my job. And it would be a part of any individual who works for county or city government to say that. And so that's one of their recommendations as a best practice. Is it followed to that T everywhere across the country? Absolutely not. Models change and things shift, but that's one of the reasons we're looking for a community-based organization to assist in this work. It really helps to keep it a little further away from government if possible.
So if you have these different lanes, if you will, right? Different lanes, this and the Annapolis Police Department, doesn't that sort of contradict our whole philosophy of the Annapolis Police Department in community policing? I mean, on one hand, we have community policing, and then now we have this, here's our lanes now. You don't trust the police, so we're gonna focus on that lane. I mean, that's kind of what I'm hearing, is the police are out of this effort, and it's based on not having a trust with the police department.
I don't think that's entirely what it's based on.
Okay,
I think
okay. That's what
community
comes
policing
across.
and this
Yeah.
can coexist. They're not mutually exclusive items. So the police still being engaged in the community and building those relationships is
Okay.
important. But if there are two 18-year-old men or boys that are arguing about something and there might be retaliation, to be able to step in and have a conversation and to mediate and understand what's happening, and that they're able to have that conversation without an immediate concern of arrest or charges or those sorts of things. That's what we're looking to build. So I think they can happen together and should happen together. But how you go about doing that and understanding that people are concerned about being arrested, right? Like that's a reality for individuals. And so this work of just building that mediation and those relationships also needs to be done a little separate, so the police can do what they're supposed to do and need to do.
Thanks.
Any other questions?
No, thank you.
For now, that's okay. Thank you so much. I have a couple of, comments, questions. First one is, suppose the county cannot find an appropriate, and I'll use that word in a wide range, organization to carry out this, because the emphasis is on some people who are coming from these communities, who know the communities, know the flavor of the communities, and are able to address what's going on. And so I guess my trepidation is beyond that. If you get an organization that seems not to be appropriate as you go along the timeline or go along next year, I've often seen in different HR situations, I'm going to kind of use that, when you have the person in charge who thinks this is the right path, but the credible messengers know from their experiences that it's not. And so you end up with a schism as to who is right. And so it's extraordinarily important for an organization who knows the community very, very well. Now, of course, we know that our staff members in the mayor's office have done the work and they know the people, but when you have that line drawn, which you need to, between the police department, that does bring another problem or challenge into the mix. So on the one hand, you get an organization that may be fine or maybe the best that we can do, but then on the other hand, you have the credible messengers who are saying this isn't the way to go. How is all of that fettered out?
Yeah, I think to some extent we'll have to see who applies, what the applications look like, and then what the hiring process is. I can't tell you in advance exactly how that would work because it may depend on who the players are and what their relationships are in the city and what the particular rub happens to be. I think having regular meetings with Cure Violence Global to walk through that in the technical assistance phase of this is what we're running into. So for instance, the violence interrupters on the ground feel that we should be doing this. The site manager or the program manager feels that we should be doing this. How do we move around that? What's been done in other places? One of the things that we have a heavy emphasis on is the evidence-based practice that this provides us. So learning from other cities that have done this work, learning from Cure Violence, and continuing to do quality improvement as we move through the process. Hopefully it's something that we could come to some resolution on. But as you mentioned, lots of different things can come up, so I won't pretend to have the answer for every scenario, but I think that will definitely help because that's not a unique situation to Annapolis that, for lack of a better term, the boots on the ground may disagree with the head, and then what are you doing there, and how do you come to some resolution on that, and really listen to those with the lived experience who are in the field, and understanding that there's space for everyone to have input.
Will the city have a role in mitigating or mediating those challenges? Say the mayor's office, will they be able to weigh in on how maybe strategically you move forward with that challenge?
Yeah, so the mayor's office has identified a liaison to participate in this process with us, so they are a part of the RFP review panel and will be a part of the hiring review panel. And then I think we have to set forward what does it look like after that. Right now we have bi-weekly meetings to talk about where we are, what's happening, how are things moving forward. We will definitely plan to continue those.
I think that's extremely important because it's obviously a very good plan. No ifs, ands, and buts about it. But the rub here is what do we do when there's an issue and how do we rectify that? Because even the folks, the staff members within the mayor's office are, I won't call them necessarily maybe official credible messengers, but they are aware of what's been going on in the communities. So for them to have a voice in all of this, I think is extremely important. We're going to be asking for reports back from them to the Public Safety Committee, so we'll know exactly what's going on, and I know some things are going to have to be confidential and will not be publicly shared. But I do believe that that's an important part of this whole process, that they've been doing the work for a good number of years, and it's important for their voices to be heard as well, and for us to get the feedback, because we're the council that represents the residents who will be affected by this. And so it's really important for us to know, give a good overview of what's going on and what's being affected in our neighborhoods, because we're going to be the ones that hear the issues and the challenges. Ms. Pettit.
Thanks, Madam Chair. One of the models that Dr. Gedden and I have talked about, not in any depth yet, but just to mood out there to help us build that collaboration and information sharing, is similar to the Opioid Intervention Task Force, which the County Health Department leads and manages. And our city teams who are engaged in substance abuse prevention and response are all engaged as part of that. And that could potentially be a model for us to keep in regular communication to share the information on the ground. One of the goals of No Harm has been to build better stakeholder engagement But that started with Robinwood, and we are now considering how do we build that out into other community partners and agencies that are working all around Annapolis, because we know we need to do all we can to combat the violence we're seeing in the city this year. So, for example, that would include the education department. At the moment, we've begun talking to them and other stakeholders as well. So something like that model might be a useful way for us to build that communication and involvement as we go forward.
Okay. I trust everyone's judgment, but we want to know as things go along, because the last thing we need is for something to happen and we weren't notified of what was going on if there's an issue. And sometimes things look to be small, but they end up morphing into something larger. So especially since this is a brand new program, we're the pilot, we want to make sure it's successful so that others can see what's going on here and they can replicate it as well in other jurisdictions. So I thank you so very, 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 very much for bringing this to our attention and for bringing this to our city, and we look forward to the collaboration. Any other questions? All right. Thank you so much, Dr. Gedden. We certainly appreciate your leadership.
Thank you.
Okay. Next on the agenda is ID 3923, Annapolis Office of Emergency Management, update. And we have Director Simmons. Chief, good to see you as always.
Good to see you as well, Kevin Simmons. Good to see you as well, Public Safety Manager. Kevin Simmons, Director of Office of Emergency Management. I do have a handout.
Are you sure?
Thank you.
Did he just turn his mic off? Thank you.
So kind of dovetailing on the Ms. Pettit's discussion on the opioid or overdose intervention team, I want to give an update from January 1, 2023 to September 30th, 2023. If you can look on your handout, and we'll start on the right page of the right upper page, side of the page, we've had a total of 90 overdoses since January 1, September 30th. If you go over to the left, year-to-date comparison from January 1 to September 30th, 2022, in the same time frame, we only had 79 overdoses. So we have a 14% increase this year in overdoses. And that could be a host of many things, the spike in the summertime, et cetera. We do have a meeting on October the 20th to kind of drill down on the data and do some analysis to kind of figure out where this 14% increase is coming from. If you go down to the, right under the overdoses on the highest wards, the highest overdosing wards, Ward 6 has 26 overdoses, Ward 3 has 25, and Ward 4 has 10. And to the left of that, you can see a summary of each ward. Ward number 1 is 6, Ward 2 is 9, Ward 3, 25, Ward 4, 10, Ward 5, 4, Ward 6, 26, and that's the highest, Ward 7, 3, and Ward 8, 7. If we continue down the page on the left, hotspots, which are areas that have 6 or more overdoses in a specific area. The hotspots are Eastport Terrace area, Newtown 20, West Street near Route 2, and the Clay Street area. Further down, the drug of choice that we're seeing is heroin, and that's at 74% of the overdoses. At 11% is polysubstances, a mixture of different substances, and 8% is unknown. So the demographics that are being affected, race, African Americans is 63% with the overdoses, and Caucasians is 34%. Gender, 76% male and 24% female, and age 45 plus at 36%, and the 25 to 34-year-old category at 30%. So any questions on the overdoses?
Maybe I'm reading something wrong. I see demographics at the bottom, Caucasian 70%, African American 30.
You're on the wrong page.
I'm on the wrong page.
You're on, okay.
Oh, okay.
So
Thank
I'm
you.
on overdoses. On the back, it's fatal
Sorry.
overdoses,
Okay,
which I'll
gotcha.
go over.
Okay, thank you
My
so much.
apologies.
Not a problem.
I
Thank
do
you.
have a question. Quick question.
Alderwoman O'Neill has a question.
Thank you very much. So under age, where it's 45 at 36 and 25 to 34 at 30, does that mean the other 24% is a mix of
Other categories,
under,
yes.
like under 24 and
Well,
between?
it's different age categories, but this is the biggest age category, the 45 plus, and then the 25 to 30 floor.
Thank
know,
you.
Any questions on the overdoses?
No.
Let's turn.
Alderwoman
let's-
O'Neill, you have, Alderwoman Tierney, do you have any questions?
Just for clarity, I just
Go
want,
right ahead.
this is where the incident happens? This is where it's reported? It isn't, where the resident lives or anything? Is this based on where the incident is reported? Okay.
That's correct. That's correct. So let's turn the sheet over, and let's talk about fatal overdoses. Let's talk about the overdoses that actually killed someone. So right now, fatal overdoses confirmed, we have 2, but we have 8 pending. And typically, the pending always turn into a fatal overdose, but we're waiting for the disposition of the medical examiner's office. So we'll call it 10. Year-to-date comparison, January 1 to September 30, 2022, at the same time, we had the same number, 10. So that has not gone up. So the highest fatals confirmed and pending, Ward 6 had 3 fatals, Ward 8 had 3 fatals, and Ward 2, Ward 3, Ward 5, and Ward 7 had 1 fatal apiece, total of 10. If you go down to the location of the fatals, this is where the fatals happen. Americana Drive, Winslow Court, we had 2 on President Street, we had 2 on Tyler Street, Silverwood Circle, Jackson Street, West Street, and Clay Street. They're locations of the fatals. Narcan was not used in 60% of those fatals. So 6 out of the 10, they didn't receive Narcan. Drug of choice, in 8 cases, we don't know yet. In 2 cases, was heroin, 20%. Demographics for the folks that died this year from fatals is 70% Caucasian and 30% African American. 100% or all of them were males. And the age group that we find folks dying from fatal overdoses, 25 to 34 age group, 50%, and 45 years old and plus is 40%. So we've had some success getting our overdoses down, but we haven't had that much success getting our fatals down. So whatever, even when we get the overdoses down, we see the fatals kind of stay the same. So that's an area we know we have to work on. Questions?
Alderwoman O'Neill?
Yes, please. So if I were to speculate, could I say that we've been really good about getting into communities such as Clay Street and Eastport, Narcan, but maybe not as good of getting into other communities where these white male 34-year-olds are, 34 to 45-year-olds are? maybe we're not quite as good about getting Narcan into those communities? And should we be spreading things out a little bit more?
And I want to talk about the Narcan and an initiative that we're working on with the health department, but we're out there. The fire department's out there, the police department is out there, the police department is following up on overdoses. NAM is doing a good job in community engagement. Sometimes you get a spike like this. It's the summertime. I'm hoping that we see a lull in these overdoses coming up here shortly. But then again, on October the 20th, we're supposed to sit down, look at kind of do some analysis and try to find out where the spike is coming from. And that'll be the fire department, the police department, OEM, and the health department, and the mayor's office. And we do case studies on the fatals as well.
Okay, thank you.
So let's talk about Narcan a little bit more. So
Did you have a question, Alderwoman Tierney?
No, I just had a comment, and it's related to Narcan. I just want to say thank you for saving lives.
You're welcome. I wish we could save more. So another tool to curb drug overdose death is Narcan dispensing machines. This is new. The Anne Arundel County Health Department will be installing 6 Narcan dispensing machines in various locations in the county, to include 1 location in the city of Annapolis. The Narcan dispensing machine works in the same manner as a snack machine without depositing any money. So it works just like a potato chip machine. The health department has asked OEM to identify the best locations for the test sites for Narcan dispensing machine. Based on the data, we identified the following locations. Number 1 is the Eastport Community Center on 1014 President Street. We went before the Hacker Board. They agreed. The folks that were attending the meeting also agreed they want this. So that's probably the number 1 place we're looking at. The second is the Lighthouse Shelter on 10 Hudson Street. We talked to the executive director, Heather Cassidy. She wants it. She's wide open to it. And the third is the George Phelps Recovery Center, which is not quite open yet. Talked to Angel Trainer. It's in Ward 3, which is the second highest overdosing ward. If they open that up soon, we'll consider any future Narcan dispensing machines at those locations. But I think the number 1 spot will be the Eastport Community Center.
George Phillips.
George Phillips, I'm sorry. I'll say Phelps.
Yeah.
I was thinking about him.
That's all right.
These machines need to be in a climate-controlled environment. The health department is responsible for restocking the machine. Any harm reduction materials other than Narcan should be at the approval of the community that's served by these dispensing machines. You can put different things in the dispensing machines. Initially, we're going with Narcan, so if we were to put something else in there, we certainly involve the community in the decision to do that or not. Any questions about that? We think that's going to happen the end of this month or the beginning of next month.
So sometimes within 1 month or so.
Yes.
I know the Lighthouse Shelter, it kind of works the other way. It's more overdoses and less fatals. So it depends on, I guess, where the community and the situation, based on what you provided to us today. Is that correct?
Right, and you were a part of the intervention we did down at the Lighthouse Shelter. We were having a spike in overdose.
Right.
I think you were a part of that. So I think that would be a great location if we were to get more.
Good. Is that something that can be part of the city's budget?
It could. Right now, this is a program that the health department is initiating. They have a grant for that. And these are actually test cases. So let's see how that goes.
Because we have our finance chair right here.
Well, on that note,
One moment. I'm assuming, unlike a snack machine, this is free.
It is free.
Okay.
It is free.
Alderwoman Tierney.
yeah, and I know the chief remembers this, that we did get an amendment in legislation that we all remember legalizing the medical dispensaries, and one of the amendments, and I'm trying to call it up, was that any new dispensary coming in within the city limits would have to pay to give us a, what are they called? The dispensing machine. Do you remember that?
Yeah, I remember that vaguely, yes.
Yeah, so the logic there was some sort of compromise, And then, and the language, if I remember, says, to mutually, acceptable location, et cetera. It was just something that it was a compromise with the owner of the dispensary that, if you're coming in, then you have to give us one of these dispensing machines somewhere. So that covers that cost. at least.
Okay.
Yeah.
So, and we have another member of our finance committee team as well. So what you're saying is if, for instance, we wanted to put one, say at the Lighthouse Shelter, what would have to occur in order for that to be paid for?
This legislation would not cover that scenario.
Okay.
Yeah, this is just,
So that would have to be a budgetary item or a supplemental appropriation if we wanted to do it within the next month or so. Is that correct?
yeah, I thought I heard that the county was
So-
going to pay for these.
So yeah, this is a pilot program. They have a grant in the health department, and being a pilot program, we want to see how it works. We want to see how it works.
Yeah.
If this is successful, and it's been successful in a DC, out west, couple of places, not many places. If this is successful, we certainly need to talk about it on the back end and what we can do, and how we can fund it, whether through the budget or grants, or whatever we need to do.
Okay, because saving lives is immediate. And definitely the Eastport Community Center should be first on the list. No ifs, ands, and buts about it. How long is this pilot gonna be for? Through the end of the fiscal year, or?
For as long as the grant holds out, and I don't know how long that is.
So it could be possibly till the end of the fiscal year?
Yes,
Okay,
more than likely.
okay, because that's something we need to put on the radar for any other locations where we see a spike, no matter where it may be.
So we have one, and then we have two identified. So if we get more machines, whether it's from the health department, provided this goes well, from the health department, or whether we look at the budget, we have sites identified already.
Okay, all right. Thank you so much. Alderwoman O'Neill?
Thank you. I have one question. I know that the county is multiple times larger than the city of Annapolis. Do we have data that reflects what this reflects for the county? The number of total overdoses and,
They do have data, and we meet at least once a month. When you're talking about how large the county is at 500,000 people, and this affects a good many folks, substance use disorder, around the county, and how big they are, it's evenly distributed. I would like to see more come to Annapolis. I'm the advocate for Annapolis. I'm the champion for Annapolis residents, but, if we have 6, they have to put 5 around the county, we get 1. Next time, we'll get 2.
actually, I
next
wasn't
time
talking
we
about
get
the
3.
dispensaries. I was actually talking about the number of overdoses per capita, basically. Where does Annapolis fall in that? Are we?
We were doing a little bit better than the county, and with the spike recently, I haven't looked at the county numbers, but I would say that we're probably about even, or we're still maybe a little bit below the county, but I have to check and get back to you on that.
All right, thank you. I'd appreciate that.
Chief Simmons, just a question, as far as oversight. What possibly would prevent anyone from emptying the machines and then selling the Narcan?
Nothing. And that's why this is a trial to see how it goes. It has to be in a climate controlled place, so we figure at the center in Eastport, and they could certainly dump the whole machine. and take it and do something. But I think with community outreach, reaching out to the community, kind of let them know the benefits of this machine, I think that they may work with us. But again, this is a pilot program, and we'll see what happens. Anything can happen.
Are there cameras at the community center?
Go right ahead, ask
Are
the
there
question.
cameras at the community center? Do we know?
I don't know. Maybe police can answer that question.
Does anyone from the police department know if there are cameras in the Eastport Community Center?
On the interior, don't believe there's anything like in the lobby.
Is that something we could consider? Would be, I mean,
I'm all for it if you can fund it. Work with Hackle on that.
okay.
But again, this is a pilot program, so we're going to look at this to shake the bugs out of it and see how we can move forward with it.
Okay. Any other questions? Yes,
Yeah,
Alderwoman
just
Chandler.
for the record, just to have on the radar, because we did rush to have this legislation on, assuming that there would be medical cannabis dispensaries, but just to have on your radar, since you're coordinating this, that the way the legislation, the amendment reads is that any dispensary receiving a city permit will have to provide one of these, and the acronym is an APM. Is that correct? An automated purchasing machine that shall dispose naloxone. I think I got this language from you. I don't know. But I mean, that's all I just want to say, instead of, if we know there's a dispensary coming in, we can at least get a free one somewhere. That's all I wanted you to be cognizant of. And I
Right.
don't know of any coming in.
So would
I
they
don't.
pay? Would they pay for it, and I could put it wherever I want it? Would it work that way? Because that would be the better
The
way.
way it reads is, as a condition of receiving a city permit, medical cannabis dispensaries must provide an automated purchasing machine, in parentheses, APM, that shall dispense, okay, here I go, I can't read, naloxone nasal spray, Narcan, or any other formulations of naloxone approved by the United States Food and Drug Administration as an emergency treatment for opioid overdose with the type of APC and a location directed and specified by the City of Annapolis in consultation with the Anne Arundel County Department of Health. So again, I don't know how many, how many dispensaries are coming within the city limits, but if there is, we've got a free one coming. That's all I just want to put on the record, right?
Okay.
I like what I'm hearing, the idea that they pay for it and we
They
can put
pay
it
for it.
where it's
Yeah.
needed.
Yeah,
can put it
as a
where it's
condition
needed,
of
right?
receiving a city permit, that medical cannabis dispensary must provide it and pay for it, including the refills, if you will. Yeah. Do you know of
Okay.
any coming in the city of Annapolis?
I do not.
I don't either.
I do not.
It's just good
Let's
to
ask
know.
planning and zoning. Let's ask planning and zoning. They'll be able to
What'd you
Yeah.
say?
ask planning and zoning. They'll be able to.
Oh, yeah.
I'll send you this, Kevin.
Any other questions or comments?
I still have more stuff.
All right, proceed.
So Pitt Moyer vaccine sites, the Anne Arundel County Health Department will no longer hold mass COVID-19 vaccination clinics at Pitt Moyer or any other location in Anne Arundel County. The latest COVID-19 vaccines are available at pharmacies, your healthcare provider, or some federally qualified health centers. In these situations, one can receive an updated vaccine paid by your healthcare provider. The health department and OEM are planning a meeting to discuss the best way to make COVID vaccine available to fellow Annapolitan community residents without health insurance coverage. So they're going to get limited amount of the new vaccine, and instead of doing a mass vax, we're going to look at maybe the Stanton Center, maybe some other places where we know folks don't have a lot of medical insurance or medical coverage, and get the vaccine to them. Just a side note to that, flu shots will be available at the Parole Health Center at 1950 Drew Street from 8 a.m. to 3 p.m. Get your flu shot. And they're available for persons 6 months and up while supplies last. Tropical Storm Ophelia hit Annapolis on the weekend, September 23rd through the 24th. Flooding was pretty extensive, as everybody knows, on that Sunday, but I'm happy to report that the property damage was minimal and no physical injuries that I'm aware of happened. Most calls for service was vehicles damaged by falling trees and utility wires down, power outages, road closures due to flooding. And economic development is assessing the financial impact of Ophelia event. Any questions about Ophelia?
No, I think hopefully we've seen the last of her.
Well, it'll probably be others, so. So we had a Chinese delegation visit on Monday, September 25th. OEM received a visit from a delegation from Changsha, China, which is designated our sister city for Annapolis, and that was established during Mayor Ellen Moore's administration. The delegation, who was in DC on an official visit, traveled to Annapolis to connect with us, their sister city. If you recall, it was our sister city, that sent Annapolis over 40,000 masks during the height of the pandemic. The delegation received a tour and an overview of Emergency Operations Center and a guided tour of the newly renovated Maritime Museum before returning home to Washington, D.C. Madam Chair, we gave them your regrets on your behalf and accepted a token of their appreciation they wanted to bestow on you. And that's sitting in my chair over there.
Well, thank you so
So
much.
they had a little something for you.
Thank you.
And that concludes my report from the Office of Emergency Management.
All right, any other questions, comments? Okay, thorough as always. Thank you,
Thank
Chief.
you.
Appreciate it. All right, next up is ID 3823, Annapolis Fire Department update. Chief Romali and Deputy Chief Spriggs.
Good afternoon, Doug Romali, Fire Chief. With me is Deputy Chief Carol Spriggs. If I could just real quick go back to Alderman O'Neill's question about the fatal overdoses. I believe that if we looked at the fatal overdoses, it's not a case of the Narcan not being readily available in the area. Most of the fatal overdoses we run are individuals that there wasn't anybody else around. Somebody's got to be there to give the Narcan, and these are individuals that had, unfortunately, either ingested, inhaled, injected their drug of choice, and there wasn't anybody around at that time. And that's why even the Narcan that Chief Simmons was talking about, that none was administered, is because those people were too far gone when we got there. There was nothing we could do with them. So as Chief Simmons said, the Narcan is out there. We're there, the health department, emergency management, the mayor's office, and the police department. So it is there, it's readily available. And as you know now, you can actually get it in a pharmacy. So and we need to continue to get it on the streets, but I don't think that that's the case, that we're not hitting those areas where the fatals were. I think it's just an unfortunate situation where there's nobody around.
Thank you, I appreciate that.
Thank you.
Okay, and October is Fire Prevention Month here in the city of Annapolis. National Fire Prevention Week is October 14th, or 8th through the 14th. And this year's initiative is Cooking Safety Starts With You. The reason that was chosen this year is cooking fires are the leading cause of residential fires in the United States. It accounts for about 49% of the fires and fire injuries. So most residential fires that we have, or at least almost half of them, are as a result of cooking fires. So we have an initiative out there just to help educate the public, just remind people to, when you are cooking, keep an eye on the cooking, don't leave it unattended. Have a lid close by in case you have a small grease fire. You can actually smother that, have a fire extinguisher close by. To also turn the handles in when you're cooking. So we also remind them of that. While that's not a cooking fire hazard, it is a hazard for the individuals cooking and children, that they can pull hot stuff on them. So we have that initiative out there. We're going to continue to push that throughout the month. of October. So we just want to remind everybody about fire safety there. And along with that, I know all of you got an invitation from the International Association of Firefighters Local 1926, who has partnered with the Annapolis Fire Department and the Naval District Washington professional firefighters to give a Fire Ops 101 course on October 20th at the Naval Fire Facility in North Severn. And that gives the opportunity for elected officials and some selected staff members to come out and really see what the fire department does. They're going to run several evolutions that you can put you through. It includes actual fire inside of structure fire to watch the fire grow, to see what it's like to be in there. Auto extrication drills, as we were talking about CPR and Narcan, there will be one there for that. And then we're also going to have a fireboat tour and show you what the fireboat does. That's important for us because you'll see in this year's budget, our fireboat's life expectancy is getting close to the end. And it's a high dollar item, but you need to be aware of what the fireboat does. There's 3 fireboats in Anne Arundel County, 3 primary fireboats, one in Sandy Point, one in Avalon Shores, and the City of Annapolis boat. And they all respond to calls throughout this county, to include the Chesapeake Bay. As with all other apparatus that we have, it's taking up to 3 years to have a pumper built. It takes 2 years to get a medic unit built. The supply, demand, and the problems that are out there are continuing to push those backwards. Fireboat would also be 1 to 2 years out. So it's important that you see that. And I know Chief Spriggs has been involved in these Fire Ops 101 courses before with some of the elected officials. You want to add anything to it?
Just to touch on, Chief Romali mentioned it is a unique opportunity for public officials to truly experience what firefighters encounter in their day-to-day lives. Obviously, the amount of heat will not be as significant as firefighters will face in a real situation, but it would allow you to see the conditions where they are asked to work. Low light, high heat, high stress. And so it'll just give you an indication of what the women and men that work for us encounter. Also, the auto extrication, you'll be able to see the tools that are used and actually feel the weight and the force that these tools use to pretty much tear these vehicles apart so that we can remove victims from the vehicles when they're injured. So it's a very a rewarding experience. I think whoever attends it will walk away with a tremendous amount of knowledge and a tremendous amount of understanding of just what the women and men that work for us do.
Thanks, Chief. And
Chief, one thing I want to mention about, you were talking about the fires on stoves, also not only children, but pets as well.
Oh, absolutely.
Thank you.
It's amazing. We've actually had fires where the pets have actually ignited the combustibles near the stove, where they've jumped up there trying to get food. And it's hard to say your dog actually started this fire, but as an investigator, I can tell you we've actually had those type of incidents. Some of them are actually caught on tape. So, yes.
Okay, thank you.
So the one last thing we have is we know every year over 350,000 people in the United States suffer from an out-of-hospital cardiac arrest, and 90% of those are fatal. And the only way to help survive that, or to at least increase your chances, is for somebody to know CPR and have AEDs out in the community. And we know the statistics show that that can increase at least 50% to 2/3 of the chances of survival if somebody starts right away. We have excellent response times in the city of Annapolis. We're there on scene for 5 minutes after every call. But after 8 minutes, I believe it is, with no oxygen, and that your chances of survival significantly decrease. So getting people out on the street to start that CPR and having an AED close by is very important. And we've had successful cases in the city where we've had people that have been in cardiac arrest and they've been able to walk out of the hospital because of that collaborative. But I bring that up because our partners in the Eastport Volunteer Fire Company came to us several months ago and said, hey, we want to give back to the community who helps us. So they came up with a program. They got a grant from the Annapolis Rotary. They also used public donations a donation from, and I want to make sure I got the name right, it's the Daughters of the American Revolution Peggy Stewart Tea Party chapter and Fidelity Charities. And they brought all these funds together to go out there and purchase 3 AEDs and 3 cabinets for these AEDs. And they went to Eastport United Methodist Church, Mount Zion United Methodist Church, and the Peerless Wrens Club, all of which are in Eastport's First Due area. But this partnership is great because we know that getting them out there and getting them in the public is going to help save lives. We hope that none of these facilities ever have to use them, but they will be on site at these facilities. We've been able to provide CPR training to the members of the Eastport Volunteer Fire Company. We've done other training, and anybody that wants CPR training can either email us at cpr@annapolis.gov or afdinfo@annapolis.gov, and we can point them in the right direction, whether it's just hands-only CPR or an actual certification class. But we're very proud of the partnership we have with Eastport Volunteers, and we think this was a great initiative that they were able to give back to the community who helps us. And we think it's going to save lives. So we think it's important that you know about that initiative and what they're doing. I talked earlier about how long it's taken to get fire apparatus built. The cost is significantly increasing too. The Eastport Volunteers actually own 2 pumpers that we run, the career members of the Annapolis Fire Department actually run. So it saves the city money because the volunteers, through public donations and grants, were able to supply these pumpers. Well, we have one that's getting 20 years old. We have one on order that was done in last year's budget. So we're well over a year into this. We haven't even gone to our engineering meetings to start the production of it. So it'll be up to 2 years when we get this built. But that engine cost in the city about $730,000. The last pumper we bought before that was in 2019. It was $525,000. And this pumper that's not even built, if we were to try to get another one exactly like it, it's coming in at $900,000. So it's gone up over $200,000 in the last year, and ours isn't even built yet. But the volunteers at Eastport are still trying to help the city out and replace that aging pumper. So we just want you to know that we have this excellent partnership with them, and they really are a tremendous asset to the Annapolis Fire Department, the city of Annapolis, and the community of Eastport. So we'll take any questions.
All right, Alderwoman O'Neill.
Can you repeat the website or the link for the CPR?
So it should be cpr@annapolis.gov. But if for some reason that's not working properly, you can always do the afdinfo@annapolis.gov, and then we will direct it to the right person.
Thank you.
Chief, you have anything else?
The only other thing I had, Madam Chair, you may remember approximately a year ago, we came to you with concerns about the hospital wait times.
Right.
And there were some news articles, just stating how bad the state of Maryland was compared to the rest of the country with regard to hospital wait times. And so we partnered with our colleagues in Anne Arundel County and met with the hospital and developed some strategies to try and reduce those hospital wait times. A year ago, our medic units were sitting at the hospital with a patient on the stretcher for well over an hour before they were able to offload the patient into a hospital bed. So we implemented this new program, and I'm happy to report that we have reduced our wait times in the city. Our average wait time now is about 36 minutes, and that's from the time that the medic units arrive at the hospital until they offload the patient. And then our average time at the hospital is 55 minutes. So that includes transferring the patient to the emergency room, and then the paramedic documenting that in an EMS care report, and then the other person getting the unit ready for service, restocking the unit, and then getting back onto the street. So we've gone from 1 hour waiting for a bed, and then the other 30 or 40 minutes restocking the unit to less than 1 hour in and out of the hospital. So that's a tremendous credit to our staff, tremendous credit to the hospital and to our partners in Anne Arundel County. So we just wanted to give you that update, make you aware of that.
That is great. Thank you so much. I really do appreciate that. That's extremely important, and extremely important for the public to hear how you all are working diligently, as all our public safety departments are, when it comes to our residents, our visitors, and our businesses as well, because the thing of it is, public safety is critical. It's critical to everything that we do here in our city, and we do truly appreciate everything that you do, especially with our partnerships. It's extremely important. And your Class 1 is the highlight of what you do, as well as the police and their CALEA accreditation. So it is extremely important, and I tout that message wherever I go, and people are like, really? Oh, didn't know that. And it affects the lowering of the insurance rate. So we do truly appreciate everything that you do.
And I'll just add, I'm going to make sure I get the right date because I think it's next Wednesday. Yes, the 11th at 1700. We're going to be swearing in our newest 5 paramedics here in the council chambers. So they'll be taking the oath of office and being sworn in and pinned by their family members. So if any of you are available to come on by, it's
Yes.
very short time. It's 5 o'clock in the evening, and we'll be done within the hour. So it's very informal, but we think it's important that we recognize every accomplishment of every member of our department, and this is the first start.
And the swearing in is where?
It's here.
On the 11th?
Was that Wednesday? What's Wednesday's date?
Wednesday, the 11th. Smack dab in the middle of transportation committee.
So there was originally a conflict, and we were told that that was changed, and we were here. The mayor's going to be here to swear him in, but that went on like well over a month ago. But we'll work on that if it's an issue.
Figure it out.
We will work on that. So I'm glad I brought it up.
I'll get back to everybody.
So yeah, we'll figure it out.
Yeah.
Okay.
Thank you much.
Questions? Yes, Alderwoman
Yeah, just
Tierney.
budget related. The fire code update you mentioned, that wasn't in fiscal year 2024. Are you talking about next year? Or at least you didn't highlight it as in the budget, a fire.
No, it's the fire boat, and it'll be in this upcoming budget.
Upcoming
The fleet
budget.
manager will be putting it in there.
Okay.
So I'm just giving you a heads up. When
Oh,
you
that was a
see,
heads up. Okay.
a $1.5 million request, that's what it is. So
Okay.
we'll be working with finance to see what the best option is there. We'll also
Yeah.
look at some grant opportunities. But the boat's over 17 years old. It's like any other boat that anytime a boat's in the water, it takes on age. We've had some mechanical concerns. So we had some serious concerns here lately. But
No,
the boat will be in the water. It will be at the boat show next week or this week, and we'll be ready to go.
Since you talked a lot about EMS, did you hire an EMS training captain?
So the EMS training captain is on board. It is Captain Ray McCrae. So he's ready to go. He was actually part of hiring these 5 new paramedics that are being sworn in next week.
Okay, thanks.
Any other questions? Thank you all so much, and as always, again, Office of Emergency Management Our Office of Emergency Management brings us through the difficult times, and we certainly are grateful for what you do with such a small staff. Appreciate it. Next on the agenda, we have ID 3623. Annapolis Police Department update, Chief Jackson and his team. Did Captain Kleindisk give you all that sheet? Thank you.
Before I get started, I probably have to give myself, or probably should give myself an accommodation. I'm here. I went to the dentist earlier today, so I'm here and I'm talking, so.
I'm going to get started, Chief, so you all can kind of get yourselves straightened out there.
Yes.
So good to have you all as part of the triumvirate. Our last meeting was held on July the 19th, and since that time, we, along with the mayor's office's pop-up listening tours, have had our public safety listening sessions throughout our communities in July and August. And so today's meeting is going to cover a wide range, but we'll see what we can do within the next 20 minutes or so. We'll start with any general information you want to give to us regarding your summer crime plan and deployment going forward with the fall plan as well as beyond.
Yes, the summer plan has.
You want to
ended.
introduce your team?
Oh, yes, I'm sorry. To my left is Captain Lamar Howard, Commander of Operations. To my right is Andrew Ascione, Acting Captain for Administration. Seated behind me is Rhonda McCoy, our Professional Standards Manager, and I know somewhere in the room is Captain Klein.
Yes, he's here, Chief.
Okay, he's in back of me, sitting in the rear, so that's who's with me. Oh, and Bernie Bennett, I can't forget him. Bernie Bennett is here. He's the Public Information Officer. Of course, Captain Kleindes is the Patrol Commander. I think that's my entire team. Just general information regarding our summer plan. We experienced for the first 28 days, I believe, a 67% reduction in violent crime. So the plan was very effective. It wasn't foolproof because we know that we had 2 homicides in the 1900 block of Copeland Street. They weren't random acts of violence like we were experiencing in the other areas, in Eastport, in Harbor House, Robinwood, Clay Street, Oldbury Court, where we had either multiple weapons discharged or a single weapon that was high-powered, and we recovered at those locations multiple casings, sometime in excess of 50 casings. And I left out Newtown Drive, that area as well. So when we look back at the summer crime plan, we saw a 67% reduction in violent crime, albeit I will submit that we weren't able to stop everything. Again, the problem area was the 1900 block of Copeland Street and Bywater Mutual Homes, but those were targeted attacks, we believe. And those are still very active in fluid investigations. So overall, I would characterize the summer crime plan as a success. Optimally, we would have liked to have 100% reduction in violent crime, but 67% shows that it was worth the expenditures, both the monetary expenditures and the man and woman power expenditures, to see to it that those random, very dangerous and reckless discharges, were kept at a minimal. I don't think there's anything else that should be noted about the summer crime plan. Right, yeah, Captain just reminded me, even in the 1900 block of Copeland Street, the Bywater Mutual Homes, that was outside of the original plan. And there was a couple of reasons for that. Thank you for that, Captain. There was a couple of reasons I can speak to for that. Number one, we hadn't had as many incidents of violence and discharge in a couple of years there. And number two, we had overtime, approved secondary employment. APD officers working in that area. In fact, I signed off just today on a number of officers who are willing to work in Bywater Mutual Homes, secondarily paid for by Bywater. And so I signed probably 5 or 6 of them today. So we'll have that augmented with our fall and winter crime plan. We'll have officers up in that area to go along with the officers that's been hired by Bywater to provide safety and security. And so that ended about a week and a half ago, and myself and my command staff, Captain Howard, Captain Klondus, Amy, she crafted the document along with my professional standards manager, Rhonda McCoy, and we have a crime plan now that's almost ready for publication. There was a couple of sticking points with Local 400, the Food Workers Union that represents our rank and file, and they had some concerns over the scheduling. And so we're going to meet tomorrow to kind of hash out with virtually a good percentage, probably literally half of the union are going to meet with me and my command staff tomorrow to hash out any minor details. But the winter crime plan is even more comprehensive than the summer crime plan was. We are tasking the sergeants and lieutenants in the field to give these men and women specific details. I will talk about that plan, and we plan on meeting with the council in sections so we don't violate the Open Meetings Act, to give you not only a broad overview, but we'll swear you to secrecy so that the bad guys don't know what we're doing. And we'll lay out everything that we've written down. We'll share it with the council in sections. I guess we have to manage that. Bernie Bennett will coordinate that. He's probably been in touch with a couple of council members to get their availability so that we can sit down with you and go over the winter crime plan. One of the vast differences, not to belabor that point, of course, there's some crimes that are indicative of the season. We are entering into the holiday season, in November. Technically or historically starts the holiday season right around Thanksgiving, running through New Year's. And, vehicles, things left in your vehicles, theft from autos, not theft of autos, but theft from autos increased on that time of the year, burglaries, robberies, especially when you are in areas where bad guys know that a lot of money's going to be spent and you look like you have a lot of money to spend. So I'm kind of jumping around on the agenda, but I think it segues nicely into one of the things that we'll be doing. Amy has begun work on it. I asked her to put together, and I'll have input on it as well. We want to give out flyers. The Police Foundation has agreed to fund it, and we want to talk about and give residents at large, we want to take them everywhere, just bullet points as to what citizens need to do to decrease their chances of becoming a victim during holiday season. We will recommend that you leave your Gucci, pocketbooks or your Prada and all of your designer stuff, both men and women, leave all your designer stuff. Carry only the things that you need, things that's just the safety tips. It will be full of safety tips, how to secure your home, not to leave your Saks Fifth Avenue. And I'm giving examples, bags on the front seat that becomes very attractive for somebody to smash your window and take it. So when you go about shopping, make sure you secure your stuff. So that's seasonal stuff.
And that's going to be added on to the Protect and Serve every other week.
That's going to be added on to the Protect and Serve, and we'll be announcing that probably again this Friday. This Friday, we're scheduled to do another Protect and Serve, and then we'll take that information in form of a public service announcement as we go into it. We'll even talk about some of the things from the winter crime plan. We'll make assurances to our residents that we're going to be out there, and our men and women will be out there, not just sitting in cars, but actually engaging in many ways. And we're still working on creative ways to engage it. One of the things we will do is give out those pamphlets to residents and shoppers alike. So we'll try to be everywhere on Main Street in your ward. We'll be everywhere where there's commerce during that time. And then we're going to talk about other safety tips as well. Some will be holiday specific. Others will be just safety tips that you can use all year long to try to mitigate some of this violence. So we're working on just so many things, and
You
so
want to
that's
go to
forthcoming.
possibly staffing?
Yes. staffing.
On the list, maybe we had talked about the last time, grant writer, grant manager, camera monitor for 24/7. I know, just want to touch on the workload, study update, any recruitment, any bonuses and incentives that you may want to mention.
All of those are pretty much grant items. I'll just talk briefly, and I'll ask the person that's responsible for that to actually talk briefly too, who just sat at the table, I should add. But yeah, I talked to retired Sergeant Ricky Truitt, and he made a suggestion. We have some cameras in, but we don't have enough to cover the entire city. I recommended that he address the council. He and Brian Paquin addressed the council with that. He has a fair number of cameras. So we have to prioritize where we want those cameras placed until we get the funding. I know it's over $1 million to outfit the entire city, but that's forthcoming. Also, I had stated in previous sessions that I wanted to have a camera monitor work 24 hours a day, 7 days a week, 3 shifts. It's been a part-time salary, and I think with benefits and fringe, we starting off around 45? 42, okay, 42. And so that's a work in progress. We're still working on that. That's a fiscal issue that we're going to take up with the city manager and Jody Dickerson to get the funding so that we can work on that. It's full-time, I was told, okay. But it'll be once I get permission and the funding to staff that, we'll have 24-hour coverage. We already have 2 shifts now. I want 1 more shift so that the cameras can be monitored full-time. Recruitment, there's a number of things we're doing. Bernie has been in contact with Mitchell, and they're going to put together a very diverse, even within the APD, Annapolis Police Department. Of course, our department is probably one of the most diverse you'll find anywhere, and we're going to gather that diversity together and make a recruitment pitch. A video was proposed, produced by Julian to appeal and get it over the airways as a recruitment tool, amongst other things. And then I just want to get the officers out there in patrol and other areas of the department to go out and sell the department on the opportunities, telling their experiences and the things that they've done to garner expertise during their careers in the Annapolis Police Department. So that's just a kind of a snapshot. And there are other things, but those are the most important things. And then we're always trying to find ways, even beyond this session, any other opportunities, which a lot of it is tied into the workload analysis and getting that grant writer to fund these initiatives. I think I missed anything.
Okay, well,
the bonuses and incentives, of course, that's a.
You want me to talk about that a little bit?
Yeah, please do.
So with respect to bonuses and incentives, just to give a little bit of background, know what kind of operating environment we have here. Anne Arundel County is currently offering a $20,000 recruitment, wide eyes on that one, right? $20,000, that's for both entry level and lateral officers. It's not one chunk payment. For example, for entry-level officers, it's $1,000 when they're hired, $4,000 when they graduate from the police academy, and then at the end of years 1, 2, and 3, a $5,000 payment for each one of those. They're not the only one. They're our biggest competitor just based on geography. But Howard County, $10,000 for entry-level and laterals, and Baltimore County, $10,000 for entry and laterals. It's a highly competitive environment.
okay, thank you, Lieutenant. Ascione?
I'm sorry, ma'am.
Thank you so much.
There was one other thing I wanted to bring up, is that so to a very limited extent, in this grant cycle, where we were able to award some recruitment, some hiring bonuses to officers, because we only wound up getting about 25% of the grant funding that we asked for. Those bonuses have been limited to $1,000 hiring bonuses for 3 officers that we have hired. So we have exhausted that funding source for bonuses as of this point. I might follow in the footsteps of the fire department very briefly, saying that this budgetary cycle, that might be something that gets brought up.
Thank you. Strategic plan, I know that's something that's ever evolving, but tell us a little bit about your county, state, federal partnerships, any intelligence, general information you can provide, tracking firearms. And we did talk about, I know my colleagues were interested in possible curfews, barricades in communities, and that sort of thing.
Yes, I'll start by saying it's a number of things, number of moving parts. I'm truly gratified, and the public doesn't always see it. Even the council doesn't always see it because of the nature of our partnerships with the federal government. Generally, when we partner with them and an investigation is initiated, they take the lead. We work with them, but then they take the lead. They're the federal government, so they take the lead, and then we have to play by their rules. I like to utilize the feds as much as possible because they have resources that we don't have, and they don't have the legal barriers at the federal level that we have in state in state jurisdictions, even in state courts, especially with the new, well, it's not so new now, but with the Police Reform Act, they can do things like execute warrants, and they can get resources and pay money and have access to equipment that we don't have. But as long as the administration of justice is served, as chief of police, I'm always gratified, no matter who gets the credit, when we can forge those kind of relationships to take care of problems. Today, Captain Howard attended, while I was at the dentist in my stead, a press conference with the federal government. They announced, how much fentanyl was it?
There was a seizure of fentanyl during this long-term investigation with the DEA area, Group 51, where we have one of our TFOs. There was enough fentanyl that was seized that would have killed 4 million people. 4 million people.
Ooh.
Along with a cache of semi-automatic and automatic weapons that easily could have ended up on the streets here of Annapolis. And once the investigation, the culmination of this investigation, I think we may find that some of those weapons that were seized during this long-term investigation may have ties back here to Annapolis. A tremendous amount of cash and over 100 kilos of heroin that was seized during this investigation in this region, reaching all the way to Baltimore, Washington, D.C., and the Eastern Shore of Maryland.
Thank you, Captain Howard, for that information. It really bodes well for us that we have these partnerships and this intelligence that is definitely benefiting us. And we know that a lot of this you cannot reveal to us because of the confidential nature of this, but we trust your judgment and we trust your actions in knowing that we are a safer city because of what you all have established with these partnerships. We appreciate that.
And I'll real quickly, and this will be a quick remark, I believe in explaining everything. When you demystify why things are done, it takes away the argument that something either unethical, nefarious, or just being elitist occurs. The only reason why we don't disclose that at the federal, because a lot of people in danger. We have undercover officers, we have paid informants, and you endanger people's lives if the information doesn't remain esoteric to some degree. Keep it, that way it's accountability. The smaller circle of people you know, the least likely you are to have a leak and put people in danger. And we have a couple other initiatives that I'll talk about some other time. That's the only way you minimize this. We play a cat and mouse game. I know a lot of residents call in frustration when they hear discharge in Eastport, and these young men, mostly, even some young women now, make the poor decision to put a gun in their hand. And these are primarily young adults discharging these guns. But it's a source of the problem. A lot of guns come into Annapolis and from other jurisdictions. And what we have been fighting with, I'll say this, what we have been struggling with as a department is to maintain the safety and security that's expected from our uniformed patrol sources, but also trying to keep people out of Annapolis who want to come here for, and I'm saying this real careful because I don't want to end up in being mischaracterized. Of course, we want everybody to come and enjoy the city. What we don't want is people to come here thinking that they can set up criminal enterprises here because we are so-called off the beaten path, with Baltimore having the struggles with violence and all that goes along with that in other jurisdictions. We just don't, we want to hold people accountable to come here and enjoy the city, not come here and set up criminal enterprises. And so we fight against that all the time. And I have to thank Captain Howard and his detectives and men and women in operations bureau who work tirelessly to make sure that we have the right partners, our TFOs, task force officers, and our detectives who work very hard to mitigate those kind of threats when they come here, and that's what they are, threats.
And as I've mentioned to you many, many times, Chief, don't tell me something I don't want to know and I shouldn't know, because I don't want to be a part of any investigation knowing certain information that's privy to only you all. And so that puts us all at risk, and I recognize that. So don't tell me something I'm not supposed to know.
Yes, ma'am.
Okay.
I just wanted to let people know it's not arrogance or elitism or just a cop thing. It's a reason for it. There's legal reasons for it. And as a retired prosecutor, you understand. Sometimes you have to operate that way. We're about ready to go into our workload study. We finally got the funding secured for that. Our administrative manager, Rhonda McCoy, and Amy are going to take the lead on that. We're all going to meet with them, and we'd like to have a meeting with everybody. I would like to also introduce Ted Knight, Dr. Ted Knight, the University of Maryland, to the council at some point. We would have to, again, do it in a way that doesn't violate the Open Meetings Act, but we're ready to move forward soon. The contract has to be signed, I think.
Yes, the contract was sent.
It was sent? It was sent?
Sent to the University of Maryland, and University of Maryland School of Criminology is who we selected.
Yes.
We did vet several other entities. University of Maryland stood out. The School of Criminology stood out to us. A contract has been sent to their legal department, and once that is signed, the chief has instructed myself and Captain McGuess to coordinate meetings with you all so you can get to meet the workload study team headed by Dr. Knight.
Yes.
Who is an Annapolitan.
Yes. Okay. That's right. He is an Annapolitan, so that even makes it more, and we'll promote that out too. That's a political move that should be communicated to the stakeholders, the taxpayers. And so while we do that real quickly, I've already started hand drawing my vision for a revamped organizational chart of the Annapolis PD. I've never shied away. I discussed it with the mayor, and he's given me his blessings, and the city manager, to publicly say that we're too short, and we need to restructure the entire Annapolis Police Department to address the needs. We cannot continue to try to use 1990s tactics to solve we're 25 years into the 21st century. We can't use late 20th century tactics to solve 21st century problems. And so the Annapolis Police organizational chart will have to reflect that. So before the study really gets going and they dig the shovel and cut the tape the ribbon cutting ceremonies, we're going to sit down with Dr. Knight and his team, and myself and my command staff, and we're going to talk about how we want the department to look based on the needs, like to expand reentry, to expand the detectives unit, to give officers, provide more officers in patrol, to have a differently structured recruitment unit. You know, right now we have one person doing everything. I like to see one person do the background investigations while the other person does the recruiting. It's more efficient that way, and it's a form of division of labor that should be carried out. I just want us to be able to have discretionary forces, so when problems do arise, that the commanders can come together and come up with a plan and dispatch those, but you need manpower to do that, and we're woefully in need of the ability to restructure. I want to bring the motorcycles back, you know, so we do our own escorts and not have to rely on the Maryland State Police. Most jurisdictions have their own. That's a pride that I think citizens will enjoy when they see 2 motorcycles escorting dignitaries, or for the games, the Navy games. We do the escorts anyway, but we want to have the motorcycles lead the motorcade instead of the state police. And so it's just, and not only that, these traffic people, not to go down a rabbit hole for another discussion, but they'll do enforcement as well, not just escorts. They'll be responsible for doing enforcement. You know, motorcycles can get places where SUVs can't get, so we're going to use them even in an enforcement mode. I'm sorry.
No, Chief, we also had talked about some other kind of outreach, public service announcements, and I know Alderwoman O'Neill brought to our attention a resident who talked about Lock Your Ride, so maybe doing some PSAs, which you had discussed with Ms. Stevenson as well as with Mr. Bennett. And Alderman Shandemeyer brought before us a drones initiative from Hagerstown that he talked with the MML delegation from Hagerstown to talk about that. And also Ms. McCoy had talked about the Ring camera and the Neighborhood Watch program. So these are some of the things that were brought to our attention in prior meetings. And then, of course, we go on to the other side of the police department, which is the community outreach part. And I know Captain Miguez is not here today, but on the list, of course, it's updating the data and how people can find it. That's been somewhat of a issue for some to find out where can you find the data on the website. Also, the recent women's conference, and we'll wait for Captain Miguez to talk about that. The community resources brochure that's forthcoming, which includes conflict resolution information that based on the Paddington court incident, we thought we would need some information in that. Your PAL program, the movie nights around the city, Anne Arundel County Public Schools character counts. So that's kind of just a litany of things that we had talked about in the past, but also present and future. So did you want to comment on any of that?
Yes.
Before we take questions from Alderwoman O'Neill as well as Alderwoman Tierney.
Yes. The data, I got a little bit confused when I was trying to access it, but I'm always rushing, so maybe I didn't take my time. I think we were working on that, right, Bernie, to try to make it more user-friendly. Yeah. The data is definitely there, though, and we'll make sure that I like to see it structured in a way that as soon as you get on the Annapolis PD website, that's one of the first links you'll click on, and we put. Christine O'Neill puts everything up there, our crime numbers, our increases, our decreases, where things are most likely to happen in terms of, and then we categorize it too, the different types of crime, the index crime that we categorize. I want to see in the future, and I haven't talked to Bernie about that, but I'll maybe do a short video. We've gone from the Uniform Crime Reports to NIBRS, National Incident-Based Reporting System, and the way we index our crime has changed. So maybe that's something that can come from me, and that could be a link that people can click on and hear my voice. I can do a video and talk about the difference and explain how that works. But, you know, something else I want to say too, we talked about the update on the crime data, and then I'll talk about the recent women's conferences. I don't think Amy is here. It was very delightful, and retired Captain Barbara Hopkins, who's here today, she was honored, and she was there. Of course, you were there, and I just thought it was delightful. The dinner was impressive, and I was really blown away by the former New York Police Commissioner. I'm writing her a thank you letter as we speak, thanking her for taking time out of her busy schedule. She was very personable. She gave the women really a lot to think about. She was fascinating to listen to, very polished, very articulate, and very experienced. So it was a good time had by all. I think my favorite part of it is the picture that I took with all the women officers. And the reason why I say that is I'm kind of in the kneeling position. The captain is on the side and shows the men supporting the women as it should be. And just the joy that the women experienced. And they were very, very kind and made me feel so welcome. So I thank them again. And they were just thanking me all night. So, it's just an example of people do care that you're competent and you have a lot of knowledge, but they also care how you make them feel, supported. And that was what I felt that night. So it was a wonderful conference. I can't wait until it happens again and they come here again. It was great for the city. If I have any criticisms, it was a little under-publicized, and I would have liked to seen it communicated better to the community. So I think it sends a strong message to high school young ladies that they do have a place in law enforcement, and if they want to be a police officer, women do excel just like the men. Right here in Annapolis, we have one of the pioneers in women in law enforcement, policing with the men, supervising the men, and I would like to see us promote those kind of things a little bit better. But then Bernie and I, we have long conversations every day, so we'll figure out a way to put that on the list of things.
Absolutely.
And one thing
congratulations again to Captain Hopkins. Thank you so much.
Yes, she received a beautiful award, and I got emotional because I know what it took, and I believe that we have to do a better job as a society of giving people their flowers while they're here. She's a pioneer, and we should celebrate that every time we see her and thank her for her service. So thank you again. And one of my favorite people to talk to. But I will say this, not to put a demo on this, but this Winter Crime Plan, a lot of our programs are going to have to temporarily be scaled back. And the reason why, because a lot of these programs that are being run by sworn members. I'm old school. At the core of what we do is protect life and property. So I don't want another person shot and we're doing things that doesn't work towards that end. So everybody's sworn, even people who are in administrative positions, as evidenced by Acting Captain Ascione, who's in full gear, and we all are participating in the so-called crime fight. I don't know a better name for it, but it is a crime fight. It's not a wage against our citizens. It's a crime fight. It's that criminal atmosphere that we're trying to destroy and take away. So some of these programs, as excited as I am, we finally got the PAL charter, a copy of it sitting in my office, and I was just staring at it because it only took 4 years, but it's sitting in the middle of my desk, and in the morning I come and stare at it like a kid who just unwrapped a present at Christmas time. So we finally have the charter. We're getting volleyball in the near future. We're going to partner with Annapolis High. We have the chess program in addition to boxing. So thanks to Jamal Davis and his good work, it's growing very rapidly. But I have to say that while we go into this crime plan initially, in the early phases of it, I'm asking everybody who has police authority to be out there to protect our citizens. So some of these are going to have to be scaled back until we really, get this crime plan up and running. So I just want to say that. The things that civilians can do, like Joe Hudson and Patty Norris, they'll still do, but the things that require a lot of sworn members will be scaled back until we can get a handle on that, like the movie nights and some of that stuff. So, we'll keep an eye on it. Character counts will still be in the schools, but in a different way. And so that's pretty much Yeah, pretty much, we're planning on having another one of our, presentations that we had with the NAACP and the caucus and Eastport Civic Association, you know, and OEM, you know, to kind of give an overview, and we all will participate in that. I think we postponed it till, you know the dates? I don't know the dates. Yeah, but we postponed it. I have to get back to you, Madam Chair, with the dates, but we're still going to have it, and we've started working on it. Amy has started working on it. So again, I'll just close by saying we have our Protect and Serve again. I would encourage everybody to tell your constituents to please log in. We give very good information on crime. You know, you're always there to support us. And we talk about a wide array of things. We ask the community for their help. I'm going to be doing some things with some civic organizations soon. We are planning that, and we want to do that soon, a call to civic organizations to help us in the crime fight and to use their time and talents to get into the crime, making our neighborhoods safe. These are non-police. These are just people who from all walks of life to really spend time with your children, get more involved in your community, those type of things. So that's forthcoming as well.
Fine. Thank you so much. Alderwoman O'Neill. No questions. Alderwoman Tierney.
Just one real quick one. I was just sort of stumped on in this year's budget that we had a state grant of $50,000 for retention and recruiting of police officers. I was just wondering how that relates to what you said about not having money for the bonuses. Isn't that what the state grant can be used for? You didn't get the state grant?
So when it comes to recruitment and retention, they're two distinct things. Aside from just monetary bonuses for hiring, and then there are some annual bonuses that we're doling out. We also have bonuses for officers who speak a second language and utilize that in an operational or investigative capacity. We're handing that out, and there are there are a number of different things that it goes into. We didn't want to target just one thing. So it is an incentive to be hired by us or to somebody else, but it's also an attempt to retain the officers, the valuable officers that we already have.
Right.
Funds are, I know however many $1,000 sounds like a lot at its outset, but it goes very quickly with the programs that are set up.
Okay. And then just lastly, I know this is a touchy subject, but is the winter plan, is any part of that going to be made public?
Yeah, what we usually do with that is talk about it on Protect and Serve. You know, the things, when we meet with you, we'll tell you the things that we would like you not to divulge publicly, but we'll make sure that you have a copy of it. And we won't post it publicly line item because it tells the bad guys how many officers we're going to have on President Street, where they're going to be at and all that. The plan, it talks about all of that. We have a seat team now, safety.
So one of the things that we're going to be injecting into the crime plan, it's going to be a highly mobile, strategically focused SEAT team. And SEAT, the acronym stands for Special Enforcement Action Team. And these guys will be laser focused on the worst of the worst. Guys that are carrying guns, guys that are involved in drug trafficking organizations, individuals that are wanted on felony warrants, and things of that nature.
Thank you,
After that, they'll be closely supervised by us, everybody at this table, and we all have a different role from me on down. They're going to be a direct report to Captain Howard. I have every confidence in Captain Howard's ability to motivate these young men and women and to train them on what they need to look for in a very constitutional, very respectful way. But at the end of the day, we want to send a strong message that what we're seeing here is just not acceptable when these young men and women make these poor decisions, you know. And what I'll have to talk about some other times, I know time is of the essence. We've had some significant arrests, some people behind bars and being held on no bail status for crimes of violence, and we're going to continue to do that. Maybe that'll be something else that we could talk about. What I want to do, once we get permission to, once all of these investigations are over, I like Christina, and I'll talk to the captain about that, to do one of those, see how everything links up and how we dismantled everything, like an org chart, to see how we dismantled it in the city of Annapolis. But I want to give a special thank you to Captain Howard and his detectives. They have really, really made a difference these last couple of months. We always wish, I sit at this table and wish that we could prevent everything, but in due time, I think I'm confident that because I said it 1,000 times, I want my legacy to be that I expanded the size of the Annapolis Police Department to address the issues and the challenges that not only we face, that most law enforcement officers face. We have to have better technology. We have to investigate more strategically. We have to use intelligence, information. You know, we're not sending these officers out there without a mission, just go out there and ride around. We're sending them out there to try to cure the cancer instead of put a Band-Aid on it. You know, quite often we get very reactionary because we're trying to get quick fixes, and that's good in the short term, but it always comes back if you don't treat it properly. And what we're trying to do is make a concerted effort to treat this properly so that we can discourage, you know, some of these individuals from coming here and thinking that it's okay to do this kind of stuff with impunity. Those days are over.
Thank you, Chief. The other thing I just want to mention, reiterate what Ms. Pettit said, we're going to be briefed individually as to a lot of things that can't be given out publicly, so I look forward to my colleagues and me as well receiving that information. The other thing about the listening sessions, I just want to mention that I'm in the process of compiling a report. I'm looking at what the mayor got back from their survey, and I plan a meeting with our state as well as our county and our school system elected officials to see what we can do, because our residents are their residents, and we're looking for resources, we're looking for strategies, but we're also going to look for funding from them. I think that's only appropriate in these days and times, that Annapolis City can't carry the load totally, that we're going to need their assistance as well. So that's kind of on the radar as we go along, and the listening sessions kind of will be the validation as to what we're going to be asking for and looking at. And I will definitely be sharing all this with my colleagues once I kind of put everything together based on all the ones that we had. I think we had about 7 or 8 of them. And so that's also on the radar as well, but that's how I see it. Our residents are their residents as well.
Yes,
and so we need several pockets of funding to look at, not just our own.
Yes, ma'am. And I always still owe you a report, and the dynamics is pretty tricky about Annapolis United. You know, to show how effective that was. It'll be more qualitative than quantitative. But I believe that we can, and we'll add that into the presentation. I know I promised you that 3 months ago.
Yeah, well, we had some other things going on that took
ma'am.
precedent.
But I haven't forgot that. That's important. So I just want to take the opportunity to mention that too, that it hasn't been forgotten.
I understand. Any other questions? Alderwoman O'Neill, Alderwoman Tierney, none for myself. Can I get a motion to adjourn?
Motion to adjourn.
Second, all in favor? Aye. 6:24 p.m. Thanks so much.
Thank you, ma'am. Have a good evening, everybody.